CoolSculpting is an FDA-approved device for reducing small bulges or pockets of fat. It was developed by Drs. Rox Anderson and Dieter Manstein at the Wellman Institute at Harvard Mass General Hospital, and has extensive clinical results and trials that have done to show the efficacy and the safety of this procedure. It is a non-invasive treatment that has minimal to no downtime and causes very little, if any, discomfort during the treatment. The CoolSculpting treatment helps diminish fat bulges by about 20% without injuring or damaging the surrounding tissue. When we originally started doing the CoolSculpting treatment, we would usually treat one area of the body, usually the lower abdomen, or we'd treat the love handles. And we noticed when people came in and had both areas treated, they got a much better overall result and were much happier with the treatment itself. We started to discuss that with our patients before we did the treatment. And so we're doing more and more what we would call circumferential treatments, that is treating both love handles and the abdomen about the same time. Currently, we're trying to treat the majority of our patients circumferentially with the CoolSculpting device if they're amenable to that type of treatment. That means if they have small bulges in the love handles and the lower abdomen. Overall, they tend to get a much better response and are happier with the therapy than if we do just a single site treatment. It's always best when I do an assessment, I have the patient standing during this process, and we kind of look at the target area and try to determine where the apex of the bulge is. And on the abdomen, we can kind of take a look and make a little mark or X in the place where the apex is. And on the love handles, we can do the same thing. I usually try to pinch the area, and I can detect with that pinching how much tissue, particularly skin and the fat layer, will kind of come up into my fingers, and I see the distance. So then after we've made our marks, we remove the gel pad from the packet, and you have to be very careful when we lift this up and apply that to the treatment area. And then I like to smooth it out to make it nice and smooth and there's no wrinkles and it's evenly placed over the treatment area. Then we'll go ahead and I'll take the correct applicator that I've chosen prior to the treatment, set the device setting, and then turn it on, turn the suction on, and then apply the device to the treatment area with a little bit of pressure so that I get a good seal and it sucks the tissue up. With the CoolSculpting procedure, most of the time it's not that people that have the treatment will notice that they've lost a pant size or that friends will come up to them and tell them, hey, you lost a lot of weight. They just feel slimmer, their pants fit a little bit better. When they sit down, they notice that the extra little roll that was there isn't as noticeable. Well, ultimately, people will see a result after one treatment. There are some people that want more efficacy with the treatment, so then we'll go ahead and do a subsequent treatment, and we usually wait about 2 months prior to deciding to do that second treatment.